All right, good morning everyone. Good morning Queensland, and good morning to our Facebook Live followers as well. So we have some really great news this morning. So if I can start first with southeast Queensland, we only have 5 new cases. 1 is detected in hotel quarantine and 4 are local community cases, but they're all in home quarantine and they're all linked to that Indooroopilly cluster. So that's fantastic news. That's the sort of news we want to wake up to. So we now have 12,364 people in home quarantine. We have 153 active cases. We've had 26,394 tests in the last 24 hours. So again, good testing numbers. But of course, Queensland, we've got to keep that up. We absolutely must. If you have any symptoms whatsoever, please go and get tested. And Queensland Health did over 3,500 vaccines in the last 24 hours. And in Cairns, we don't have the private testing numbers back yet, but we have 971 tests that were done yesterday in Cairns, which is fantastic. Now, Dr. Young has also informed us some very good detective work in Cairns overnight. So they've actually linked the taxi driver with the marine pilot. So the marine pilot actually travelled in that person's taxi. So a lot of contact tracing is now happening, of course, with those exposure sites, but it's great to know that linkage has been done. So honestly, great work by our Queensland Health staff. Fantastic news there. So look, I know that Cairns is in that 3-day lockdown and we hope that everyone is doing the right thing. It's really important, if you're in Cairns, to be staying at home and only going out for those essential purposes. So we want to make sure that we get all of those contacts from the taxi driver into home quarantine as quickly as possible to keep that community safe. And I know that the Cairns community will step up, just like the Townsville community stepped up when they had to as well. So I congratulate everyone for doing the right thing there. And of course, Queenslanders in the southeast of those 11 LGAs, please make sure you have a look at that roadmap and please continue to do the right thing. It's really important to be checking in. We're using your check-in app. It's important to get tested if you are feeling sick. And of course, now the high school students are wearing masks, and I thank them all for doing that. And from all reports from education, there's been no issues with the distribution of masks there. Okay, Dr. Young will also address, there's been some questions about community sport, and it does include not just school community sport, school age, but it also is adult community sport as well. So it's the next 2 weeks, but she'll address that. Now, I want to talk to you about some good news about where we're standing today, and of course that's the Brisbane Convention and Exhibition Centre. And what we're doing is we're opening this as a mass vaccination centre, which will be starting this Wednesday. So we're getting a sneak preview today, and thank you to the staff here for being so quick in setting it all up with Queensland Health. Now, the federal government is responsible for 70% of the vaccination of Queenslanders. Queensland government is responsible for 30%. So what we do know is we're getting on some of that, that Pfizer is going to be coming on faster over the next couple of weeks. So from Wednesday, this convention centre will be open from 8:30 till 4:30, and we are now asking people, if you are between 16 and 59, you can now register on the Queensland Health website. Now, of course, a lot of people will still be going to their GPs or the pharmacists to get their vaccine. I've just heard, I think, that the Commonwealth Government has also approved Moderna, so we'll be getting more information about Moderna. But this is a great centre here for people who are already on that waiting list from Queensland Health. You will be prioritised, but as we work through that list, now we are opening it up for anyone between the ages of 16 and 59. And on top of that, there'll be free parking here as well, which is fantastic. Now, please don't just turn up. This is not walk-ins. You must be registered and you'll be contacted by Queensland Health. But we want to see as many people in Queensland vaccinated as quickly and as safely as possible. So there are now additional options that will be open. So that's fantastic news, and we're looking forward to seeing this open, and it will also be open 7 days a week, and it'll be open on the weekends as well. So please hop on that website today, register, make sure you do the right thing. You're not only protecting yourself, you're protecting your family and you're protecting your community. So with those few words, I'll hand over to Dr. Young, and then we'll do some questions afterwards. Thanks. Thanks, Dr. Young.
Thank you, Premier. So excellent news overnight. All of our cases were in quarantine during their entire infectious period. So that one person who returned from the Philippines and went into hotel quarantine tested positive, so we're all used to that. And then our 4 community-acquired cases related to the Indooroopilly cluster, who were all in home quarantine during their infectious period. One of those, so I'll go through those 4 cases. One of those is a staff member at the Ironside school, so we're still seeing first-generation cases. We all have to remember that the incubation period is 14 days, so it's really important that people, all of those 12,000 people, do stay and adhere to that quarantine as we go forwards. Then one was a parent related to a child who attends Ironside. Another is a household contact of someone who attends Brisbane Boys Grammar School. And the 4th is another household contact of someone who attends Ironside. But the important thing to note is that the incubation period is 14 days. And unfortunately, that means that anyone who's in home quarantine, if they become positive, that entire household then has to remain in quarantine for another 14 days. So this is a lengthy process that we all have to work together to get through. Now, there are some... Oops, I'm losing my... Right, I won't touch it. There are some... There have been some questions, I'll put it that way, raised about community support. Now, it's really important for the next 2 weeks that people do what they did over those 8 days. So just think, is this really necessary? So if you're questioning whether you can do something, then probably you can't. So for community sport, it is fine for up to 10 people to gather in a public place, but you must wear your masks, you must keep social distance, and you can't come into contact with people. That's really, really important. So if your sport is one that involves contact with other people, then it can't go ahead. But if it's golf or tennis and you've got a small group and you maintain that social distance and you wear your mask unless you're strenuously exercising, then it's fine to go ahead. And the same with indoors. If it's a dance class and there's no contact between the dancers and there's one person, maximum one person per 4 square metres, that's fine. So, and then people have asked about bridge. Well, the same thing. If you've got, you can have up to 10 people in your home. We know that. Or if you're going to a commercial venue, you can have one person per 4 square metres. So people have done this so well, and I'm sure they can sort out going forward what they can do in terms of community sport. What I don't want to see is kids from a whole lot of different schools all coming together, because we know that that led to a significant part of this most recent outbreak that we're still working through. We had that karate class, for instance. So it's really important that people use their common sense, as they've done so beautifully over the last 8 days. And this is for the next 2 weeks, while we just make sure that we don't have any cases that are out and about in the community, because we're only just started to have those days of 0 cases infectious in the community. That's really important for South East Queensland. Then for Cairns, it's vital that you are now in lockdown for 3 days while we work out all the contacts of this taxi driver, and we go back and reassess all the contacts of that pilot who brings ships in through the reef. So clearly we've found on whole genome sequencing that the taxi driver acquired it from that pilot. We suspect it was when he drove that pilot from his home to the airport, and that pilot then flew down to Brisbane. So we're just going back and checking all of those contacts and just making sure that we have all of them. So it's really, really important that people in Cairns, any symptoms at all, don't wait for a call from Queensland Health. Just come forward and get tested. And the numbers yesterday were magnificent. People did exactly that. So thank you very much. It's really important going forward so we can find if there's any other clusters of cases or any other chains of transmission, so we can manage them as quickly as possible. Then down in the Gold Coast, we do have that one case down there who did test positive. So for the Gold Coast, it's really important that you also, any symptoms at all, please, anywhere in the Gold Coast, come forward and get tested. And that's really important to do today as we just work through what the risks are from that particular individual who came forward so quickly to get tested. So all of those things just need sorting, but the general message of course remains the same. It doesn't matter where you are in Queensland, we have no idea where this virus is next going to pop up. So please, any symptoms at all, don't think it's your normal hay fever or normal whatever, just come forward and get tested. So we had 26,000 people do that yesterday. Earlier last week we had over 50,000 people. So please, it's really important we continue those numbers. Thank you.
Well, here in the southeast, we continue to see the kind of trend that we'd hoped to see, a decreasing number of cases, all linked, all in quarantine during their infectious period, and a continuing high testing rate. From here, our defences rely upon those more than 12,000 people in home quarantine, as well as our border restrictions attempting to contain cases from coming from other states, and the other restrictions in our community, social distancing, QR codes, wearing of masks, and for the first time students in schools wearing masks, and increasingly vaccinations. It's wonderful to be able to reach the milestone where we have sufficient vaccine supply to be able to open up these kind of mass vaccination centres like here at the Brisbane Convention and Exhibition Centre for Brisbane folk to be able to get an appointment and a message to say they have an appointment, be able to drive in, park for free, come up here, be greeted by our wonderful health staff, get their vaccination and be on their way again is all about making vaccination as safe and convenient for thousands and thousands of people as we possibly can, which will supercharge our vaccination rate, which is exactly what we're trying to do. For those in Cairns, everyone in the southeast is thinking of you. We know what you're going through. We've just been through it ourselves. We are aware that some of the supermarkets are experiencing challenges with the number of their own staff who are now considered close contacts. And so I just wanted to thank our supermarkets for the great job they're doing, the shop assistants and shop workers who are doing a fantastic job, and really just urge people to only buy what they need, only go shopping alone rather than in groups, and to please be patient.
So great news again today, and thank you to Cairns. We hear it's quite very quiet up there at the moment, so everyone's doing the right thing and staying home. I do want to just do a shout out to businesses. The current level of restrictions are 1 per 4 square metres. A lot of the images we saw last night of venues opening back up and everyone going out and enjoying themselves, it does look like a number of businesses are operating at full capacity. So I do remind businesses that 1 per 4 square metres, one is lawfully required, but it's so important. If we do this right for the next 2 weeks, we can ease restrictions further, but we have to make sure that we've got that social distancing happening at our venues. So by all means, go out and support our cafes and restaurants and businesses, but remember, we all have an obligation to socially distance and have that 1 per 4 square metres. Now today, opening the Brisbane Convention and Exhibition Centre on Wednesday, us being here for a sneak peek today is so exciting, and I thank Metro South Hospital and Health Service and everyone who's been involved in getting this up and running so quickly. We've been able to bring this forward because of the extra visor that is coming this week. Now, we don't have it yet, so we'll start on Wednesday with about 1,000 to 1,500 vaccines a day. And when we get that extra vaccine, which is due on Friday, we hope to be doing 3,000 a day by the weekend. So we'll have a lot of staff on board, and we remind people this is not a walk-in venue. You must book. But to get a booking, you must be registered. So today, we open up for 16 to 59-year-olds in Queensland, not just here in southeast Queensland, but across Queensland. Jump online and register on the Queensland vaccination website. You have to be in it to get it. If you're not in our register, we can't offer you a booking, because in the regions particularly where we have vacant booking spots, because we've done many of our 1B group, we don't want to see any booking slots sit empty. We want every jab going into an arm each day. So here's your chance. Get online and register. And as booking slots become available, you will be invited to take up one of those booking slots, which could be here at the Brisbane Convention and Exhibition Centre. We have also organised that if you are here for your vaccination, your parking will be free. So that's really important. You don't have to worry about the cost of parking here at the Convention Centre if you are getting a vaccination. So we can't wait to see this place buzzing from Wednesday and lots of people getting their vaccination. So don't wait, jump online today and register your interest to get a vaccinate anywhere in Queensland. Thank you.
Morning. So as you've heard, we've transitioned to the next phase of our operation with the lockdown in southeast Queensland ceasing yesterday and the lockdown in Cairns commencing as well. We're very pleased with the level of cooperation we're seeing in Cairns at the moment. So the engagement between our agencies up there, the local councils and in particular Yarrabah Council has been very good. So the message to all of the community up there is please make sure you abide by those restrictions as they are. Operationally yesterday, obviously with the ending of the lockdown, we did intercept less vehicles, but 1,040 were intercepted and 21 persons were issued with fines for not abiding by the lockdown before 4 p.m. We inspected 204 businesses, and whilst all were compliant, as the Health Minister has just indicated, we have got changed restrictions. So for those businesses operating, make sure you're abiding by the current restrictions. We do have the ability to retrospectively investigate and will where we see any issues. We had 61 calls for service, so a big thank you to the Southeast Queensland people in the 11 LGAs for all the assistance that we got during that lockdown. It was very important for us being able to police that. And I just want to finish off by saying that we had one arrest, which was for a person who had breached a domestic and family violence order, as well as the restrictions, and 42 penalty infringement notices. And of course, the final word, the masks, the issue that we are most concerned about. 292 handed out by police yesterday and 15 on-the-spot fines. That's still not where we want to see it. So please, please, the message, make sure you carry a mask, make sure you wear it when you should. Thank you.
Who takes some questions?
Is there any reason why the taxi driver wasn't picked up in the initial contact tracing for the marine pilot in Cairns?
All we heard is that he's been picked up now, so you know, Queensland Health will go back and review everything, but you know, we can't get every single contact. But now that we know that, that's a great help, great assistance, and it will help us, you know, track down all those contacts and get them into quarantine.
And aside from the convention centre, have you got plans for other mass hubs?
We will. We'll be thinking about other ones, but let's get this one up and running and see how it goes. And of course, we'll take the learnings from that. But as you can see from behind me, it's ready to go. There's been a lot of planning that's gone into this, and I really thank the convention centre for helping set this up over the weekend. So it's going to be bustling from Wednesday onwards.
When you ramp up to the 3,000 doses on the weekend, is that Pfizer and AZ?
My understanding is Pfizer. Yep.
How much AstraZeneca?
Sorry?
How much?
We're just doing Pfizer here.
Oh, it's just Pfizer.
Yes. Yep. So it's the supplies from the Commonwealth, and of course people can go and get AstraZeneca at their GP and at their the pharmacists as well. So we just urge people, especially between that 16 and 59-year-old age bracket, hop on the website and please register. And as the Health Minister said, if you're not on that register, you can't get it.
How were you able to secure more Pfizer? Has this been brought forward?
The federal government has brought forward the supply for September into August, and they've done that, my understanding is, for Queensland, New South Wales and Victoria.
Is that 971 tests in Cairns, is that a bit low, or is that where it should be?
That's the Queensland health data. We just don't have the private pathology tests at the moment. So we'll get that later on the day and we'll get that out to you.
The New South Wales Premier has sort of been flagging this idea of it when they hit 50% starting to ease some of their restrictions in New South Wales. First of all, do you think that's consistent with the National Cabinet Agreement? And secondly, what would that mean for the border here?
That's honestly a matter for her, and you'll have to ask her what those easing of restrictions would look like. So I don't think they would be the easing of restrictions that we've had here, for example. I think they would be very minimalist, but you'd have to ask her. I'm not commenting on New South Wales, but let me say this. We are absolutely concerned about what's happening in New South Wales. The further north the virus travels is alarming for us, so we'll be watching that incredibly carefully. So we already have those border patrols and those border controls in place at present, but if we have to go harder, we will.
How could you go harder, Premier?
Sorry?
How could you go harder?
Well, we can go harder by, it would have to be stopping everybody. Okay, so we are very concerned at the moment. We're not at that stage, but if we have to go harder, we will.
Tom Tate says that if there are more cases in the community in Brisbane, but none on the Gold Coast, there should be a hard border at Logan.
Well, the reality is we are still investigating that case at the moment on the Gold Coast. There have been exposure sites on the Gold Coast. So the Gold Coast is incredibly close to the New South Wales border. So the Gold Coast is still of concern. That is why it is included in one of the 11 LGAs.
In Victoria, are you aware of a positive case that's travelled from the Gold Coast to Lismore and has been infectious in Byron Bay community for 5 days?
We're just starting to hear some issues around that, so we'll wait to get some more information from New South Wales.
In Victoria,
Yes.
There's mass vaccination for under 40s using AstraZeneca. Why aren't you doing that here, and is it something you'll consider?
Well, we're not doing that at the moment because that's what the GPs and the pharmacies are doing. Now, as I said clearly at the start of this press conference, the federal government is responsible for 70% of the vaccination of Queenslanders, and we are responsible for 30%. The best way to go and get, one of the best ways to go and get your vaccine is to actually go and have that conversation with your GP or your local pharmacist. And we know Queensland is such a decentralised state, that's what we'll do. That's what people will do. But we're responsible for 30%, and we're really happy with the rates of vaccination that we're having now. Of course, that's why we're opening it up more, so we can actually do more and get more people vaccinated, because as we know from the National Cabinet decisions, we really need to push the whole population to 70 to 80% vaccination.
So, Premier, are you saying that won't be necessary in Queensland?
Well, people have the options now to go to their GP and to go to their pharmacist to get AstraZeneca. So people have a choice, and today they're going to have an extra choice because we've just heard Moderna's coming on board. So we'll be really interested to hear from the federal government how that Moderna is going to be distributed as well. So that just came on the radio, is my understanding, about 10 o'clock, just before I came here.
Premier, would you prefer Gladys Berejiklian to wait until there's zero community transmission before she opens up?
I think everyone's sort of getting ahead of themselves with the definition of opening up. So I think you need to go back to her and ask her what easing of restrictions might be. I think you will find it is very minimalist compared to like where we are, where the LGAs have done and the families have done such a great job. We have been able to ease those restrictions where schools can go back, businesses can go back, and we're monitoring that over the next 2 weeks. So we put in place a roadmap, and the roadmap is very clear for Queenslanders to see where we want to be in 2 weeks' time. But of course, that depends on whether or not we have any community transmission that's out of that cluster.
Do you have a benchmark as to when the border with New South Wales may be reopened?
No, we don't. No. Like we said, they've still got a lot of cases down there, and it depends on the next weeks and months what happens in New South Wales. So we'll be monitoring. We monitor that every single day. Dr Young briefs us every single day. She looks at all the sewage testing across New South Wales, briefs us on that, so we'll be closely monitoring it, Lane.
Premier, if I could please ask you about a particular case. I'm not sure if you're aware of Don Barber. Awful story. His son was involved in a motocross accident in Townsville 2 weeks ago. He applied for an exemption. He's fully vaccinated. He's returned negative test results. He's been isolating, but he's being told he must spend 2 weeks in hotel quarantine at his own expense. As the vaccine rollout furthers, surely these are the sorts of cases we can start being a little bit lenient towards?
Well, look, we've got an exemptions unit. We'll look at that. But, you know, I have had both of my vaccines and I spent 2 weeks in hotel quarantine. That's to keep Queenslanders safe. But in terms of the individual exemptions for whether it's funerals or visiting loved ones, that's why we have increased the exemptions unit. I'm not aware of that particular case, but we're happy to look into that for you.
Dr Young, are you aware of that case? He was told unless it's an end-of-life situation, his case wouldn't be considered. His son's been in a coma. He's slowly starting to wake up, but his father obviously wants to be by his bedside.
Of course he wants to be. So, yes, we immediately, as soon as we were asked, said he could come to Queensland, because you need an exemption to actually come into Queensland. And so we gave that exemption immediately. And as you say, it's now been a while. So he just needs to come, spend that 2 weeks, and then, of course, he can see his son. And we do have processes that if people are at end of life. But if they're not at end of life, they do need to do that 2 weeks. As we've just seen with this marine pilot, just because you're fully vaccinated doesn't mean you can't transmit the virus to someone else. So, yes, we have worked with that family. It's a tragic, it's an awful situation, and I'm glad that his son is starting to wake up. That is very good news.
In these medical situations, even though family members are double vaccinated, how long are we going to ask them to go into hotel quarantine for? Surely we need to start opening up a little bit more there.
Well, the National Cabinet has discussed that, and so it's when we get to that 70 to 80% vaccination of the population.
Dr Young,
have you heard about this Byron Bay case? They went to
Yes, so their Chief Health Officer rang me very early this morning. So they're interviewing the case at the moment to find out where he's been, and they're sending the specimen up to us so we can do whole genome sequencing on it. So hopefully if that specimen gets to us today, we should have a result sometime tomorrow.
Dr Young, given that children and teenagers have formed the bulk of the cases in the Brisbane cluster so far, what does that tell you about the changing risk profile for children and teenagers?
Well, as we've all seen, I mean, there's two different issues here. It's spread in schools, so therefore we would expect that they're the majority of the cases because that's what was involved. It was all school-related. But we do know with the Delta variant that it does spread more readily in children compared to the variants we had last year. So last year we saw very little spread in children. This year we're seeing a lot more.
Why not offer AstraZeneca here in addition to Pfizer? I mean, it's a large centre. I mean, if there's ample supply.
Because we've got the best pharmacists and GPs in the country. So Queensland rolled out the vaccine through community pharmacists first in the country. We have got a massive vaccination system here already. We don't need to do it in Queensland Health because we have got pharmacies open throughout the state. We have got brilliant GPs who vaccinate so well. We don't need to do it. The reason we're doing Pfizer is because it is much harder to use because you've got to dilute the vials. We'll see what happens with Moderna because Moderna you don't have to dilute. You can just draw up, so it makes it much easier. So that's why we're focusing on Pfizer. It's just a slightly more complicated vaccine. It needs different storage requirements, all of those issues. Whereas AstraZeneca is a very easy vaccine. So why wouldn't we get people who vaccinate all day, every day brilliantly? I mean, our local pharmacies have been vaccinating for flu since 2012 in Queensland. They're very good at it. And I actually spoke to the Pharmacy Guild. I think it was one of the first things I did at the start of this pandemic back in January last year and said, do you think you could please get all your pharmacies organised so when we one day get a vaccine that they can go and vaccinate? And they did it. and they did it brilliantly.
And with this hub, assumedly you're starting with 59-year-olds and working back?
No, that's why it's really important that people go and register. I don't want a single vacant booking in this hub. That would be awful. Just imagine if we've got spare bookings, because you can't keep this vaccine. Once you've diluted it and drawn it up, you've got to use it. So we need to have lots of people, hundreds of thousands of people registered that we can pull, and we'll pull them from the oldest down, making sure, of course, that if there are any frontline healthcare workers, aged care, disability care, and now teachers, freight workers, we'll pull them first, but if we've got spare slots, we'll pull people from the oldest down to the youngest. But please, everyone, please go and register so we can pull you in to get vaccinated.
Dr. Young, is there
A couple more, we've got to look around the centre, and then I've got a cabinet meeting.
Dr. Young, is there capacity on the website for people to say that they're teachers or to say that they're pregnant?
Yes.
Is it just a drop down?
There are drop downs, so there are ways people can do that.
Dr. Young, epidemiologist Emma McBride has criticised your comments around AstraZeneca for under 40s, saying she believes it's undermined confidence in that vaccine. Has the risk profile changed enough that you should advocate for under 40s to get AstraZeneca if they can't get Pfizer?
Ever since we've had our outbreak here in the southeast of Queensland, I have said that anyone who's got any concerns at all and would like to know something about the AstraZeneca vaccine should immediately go and talk to their GP about it. I personally have had my first dose of AstraZeneca. I will be having my second dose tomorrow. My GP is giving that to me then.
Do you need to do more to endorse that vaccine, though, given that it may be harmful? Your comments may have contributed.
No, I've endorsed it every single day. Please, everyone, if you are 60 years of age or older, I've been saying this every day for months and months and months, going right back to last year. Would you please go and get vaccinated? It is really important. If you are under 60, please go and talk to your GP or register to get Pfizer at one of our sites.
If I can ask you just quickly about South Australia, are we any closer to relaxing the border with them?
Well, they've still got restrictions in place. Once they've removed their restrictions, we'll of course look at that and remove ours.
That's what it'll take to reopen?
Well, they're tighter restrictions. So they've still got tighter restrictions in place, as we do. So their border is closed to us, I think very appropriately so, and similarly we've got restrictions with them.
Just very quickly, Dr. Young, just quickly following up on that early question, is a bit of a failing in contact tracing that this taxi driver wasn't picked up, in your view?
No, of course not. We do our absolute best. We work with individuals, but individuals don't always know everything, and that's why we have to keep restrictions in place now for another 2 weeks. We hope we've got everyone, but we don't know that we've got everyone, and we can always see that you can subsequently get cases, as has occurred in Cairns.
Thank you. Now the cameras might need to get ahead of us. So, good.